Joining us first is Dr. Honnie Bermas, a breast surgeon. Dr. Bermas, thanks for being with us. We appreciate it.
Thanks for inviting me.
Okay, so our first question as we jump right into this is breast screening recommendations have changed recently. Most people thought, starting screenings at age 50 was, the standard, and now it's changed to age 40. So why did those screening recommendations change?
In recognition of the fact that a significant number of women have breast cancer between the ages of 40 and 50, there was a lot of backlash saying that we should really be starting at 40. And so they recently changed their guidelines to say, yes, you should start at 40, and then maybe you should do mammograms every other year. But I think that there's some recent requirements for breast centers of excellence that they do a risk assessment for every woman coming through the breast center. So anyone having screening or diagnostic imaging would have a risk assessment, so every woman will know her risk. And that level of risk will drive screening recommendations for her.
Okay, and that was going to be my next question, this breast cancer assessment or breast cancer risk assessment. What goes into that, and when should women start, and what kind of knowledge does it provide?
So it's been a somewhat haphazard affair for a long time, meaning that if you were referred for a high-risk clinic, you underwent risk assessment, which means that the provider would take into account your risk factors, including your mammographic density and your family history and your reproductive risk factors, and would calculate your average risk of breast cancer compared to an average woman in America. But that was only if you were referred to a high-risk clinic. So now ThedaCare is a part of an organization called the NAPBC, which is an organization that's sponsored by the American College of Surgeons for sort of breast centers of excellence. And one of the requirements is that every woman who comes through the breast center, either for screening or diagnostic, which is a problem-solving mammogram, have risk assessment. So now everyone will have it on a population basis.
So for many years, women have been recommended to do some self-breast exams. Now that's changed to self-breast awareness. What's the difference between the two, and what should women know?
I think it's become quite clear that breast self-exams are actually not all that reliable for picking up cancers. For example, in a trained provider, what's called a clinical breast exam, so by your doctor or someone like me who's a breast specialist, it's quite clear that my ability to pick up a breast cancer on exam is about 50%. So reflecting that very low level of accuracy, breast self-exam in a very sort of cut and dry sort of way, same time every month, has really been discouraged. And so what's become quite clear is that, women are pretty good at picking up a problem just in sort of their daily lives. So when they shower and they soap up, or if they're looking at themselves in the mirror, they're likely to see something at about the same rate that they would find it if they were aggressively doing a breast self-exam. But generally speaking, the best way to pick up a cancer is screening mammography.
Okay. A lot of women might feel nervous about getting a mammogram. They might be afraid of what the outcome would be or just the process itself. What do you tell women to help reassure them and empower them to get screened?
My approach tends to be I'd be much more afraid of an advanced breast cancer than I would be of a mammogram. So I usually say to them, the earlier we can find it, the more likely we are to cure it. And so, the mammogram is usually quick and easy. Some women do have some discomfort with the mammogram, but I think in the scheme of things, it tends to be fairly minimal. And so I tell women, there's nothing else that can take the place of a good mammogram. Thermography can't, a breast exam can't. So really, I would say to them if the best thing they could do for their health is to have a screening mammogram as indicated by guidelines.
All right, Dr. Bermas, this has been really good information that you shared with us. We appreciate you helping us out.